HIV/AIDS treatment has come a long way over the past 40 years. Scientific advances, such as the use of antiretroviral therapies, can combat the disease, but testing has been problematic, especially for the developing world. Current HIV test kits are expensive and bulky. They must be refrigerated at all times, and they can only be performed by trained technicians. This lack of testing is costing lives. In 2021 alone, 680,000 people died from AIDS-related illnesses, with the greatest loss of life taking place in developing countries that have limited resources. Having an affordable, rapid self-test that can detect the disease in its early stages is crucial to saving lives. And that's what inspired a team of scientists, engineers, medical professionals, and students at Florida Atlantic University to tackle the challenge. FAU's Waseem Asghar, an associate professor in the Department of Electrical Engineering and Computer Science, and Massimo Caputi, a professor of biomedical science in the Schmidt College of Medicine, are collaborating with colleagues at the University of Virginia and the University of Pennsylvania to develop this important technology. Asghar and his team designed a rapid, automated self-test that can detect HIV during the early stages of acute infection, doesn't require refrigeration, skilled technicians, or expensive machinery to operate, and delivers results within 40 minutes. They received a 3-year, $1.3 million grant from the National Institutes of Health for their work. The technology being developed by FAU and our colleagues holds enormous potential to alleviate suffering and improve treatment outcomes around the world.